I think you can, I mean, I think you can have both. They work well together. But I think people tend to focus more on goals than habits. And it's one of the things I talked about earlier, but it's worth repeating, right? People, I would say the vast majority of people coming into the program who are overweight, their focus is their weight, right? They think that success will mean getting from 220 pounds down to whatever, let's say 130, 140 pounds. And I have this magic wand question, like, pretend this was my magic wand. It's kind of my test for what would you wish for? And that's what they wish for. I wish I was such and such weight. But if you really think about it, the only problem there is how did they get to that high weight to begin with, right? And so even if I could wave this wand and bring them back down to the 130, 140 pounds, if we haven't done anything to address the behaviors or reasons why they got to the high weight in the first place, there's a really high chance they're going to end up back where they started. I think that's a reason why, say, gastric bypass surgery is not successful long term, is because it hasn't done very much to change the psychology or the relationship that a person has with food. Now, on the other hand, if I can get that patient really thinking about what factors led him or her to get to such a high weight, whether it's a knowledge gap in terms of what they should be eating, so they need to spend some time consistently learning about what a healthy diet looks like, whether it's how they respond to difficult emotions, and so helping them to learn how to handle emotional eating, or whether it's just building certain skills like batch cooking and learning how to eat out less and cook in more. Now, those are changing actual behaviors that, if they were to successfully adopt, would not only help with the weight loss, but also give them a stronger foundation so that they don't end up back in the same place that they were before. So my own bias is towards getting people to focus on habits and processes, and then using the goals as something like, to aim for, but always their focus is on what they're doing, and using objective measures as a feedback for whether they're on track or not. Because as I tell people, when you think of Dr. McDougall or Heather McDougall or Jeff Novick or any of the staff of the McDougall program, myself, or any of the plant-based experts out there, Esselstyn and Campbell, none of us are trying to achieve this optimal weight. We're not like actively thinking, what do I eat in order to get to such and such weight? Really, what we're focused on is eating healthy, whole, plant-based food. And you see the sort of natural byproduct of that. The natural byproduct of that is, the vast majority, as far as I know, of plant-based experts out there have an ideal weight, and they were, without even aiming for that, right? What their focus is the healthy habit of eating healthy plant-based foods. The natural result of that is optimal health, one measure being weight, other measures being blood pressure, cholesterol, all of that. So you can see that if you focus on the behaviors, the results tend to take care of themselves.